how effective is cabozantinib for ROS1 after progression on crizotinib?
So I think that is an excellent question, and unfortunately, there isn't like a big data set for cabozantinib use, but there are several preclinical studies and case reports that showed that cabozantinib appears to have activity in specific mutations after crizotinib resistance, and these include things like D2033N and L2086F. So I think in those scenarios where you have a specific resistant mutation after using crizotinib, that cabozantinib might be able to cover for, that is an indication where I would probably try to get an off-label use of this drug.
Yeah, I agree. Cabozantinib actually has a lot of activity, even for some of the compound mutations we can see with crizotinib and entrectinib. And so on plastic in the laboratory, it's actually pretty effective at overcoming resistance. But this is in the setting of certain resistance mutations when we have on-target resistance. Now, if there's off-target resistance, cabozantinib may be a little less likely to provide that same benefit. So if possible, if a tumor were to progress on crizotinib, I think that doing a biopsy and repeating the testing could provide some useful information. And if you really saw something else, you probably wouldn't see MET amplification after crizotinib. But if you saw KRAS amplification, for example, then cabozantinib probably not going to be a very good choice, and chemotherapy may be more appropriate. Is that a reasonable approach, Dr. Nagasaka?
Yeah, I agree.
Of course, if trying cabozantinib, we also have to remember there are a lot of side effects with that drug. That is a very difficult drug. Do you have a lot of experience with that, Dr. Nagasaka?
Yeah, I find the skin toxicities to be pretty tough, as well as GI toxicities.
Yeah, it's difficult medicine. A lot of hand-foot syndrome,
Correct.
sometimes in the mouth, diarrhea. So it is a challenging medicine, and I think you can make a good case for using chemotherapy in that setting. A lot of ROS1 dependent cancers respond very well to a chemotherapy drug like pemetrexed, right?
That is correct.